This is WorkSpan TV. I'm Ryan Johnson from World at Work. We've got a special case study today about Banner Health and employee engagement at Banner Health. And I've got Ed Oxford, and I've also got Beth Stiner from Banner Health. And Beth, Banner Health has come up with sort of a unique definition of engagement. It's something that the consulting firms and a lot of other organizations try to promulgate their own definition of engagement. Let's talk about the Banner Health definition of engagement and how you've defined it.
We looked at our data from our Voice of the Employee survey back in 2010, and we wanted to look at what were we finding in the data that would drive business outcomes. And as we looked at that, we found that we were lower in areas around communication, involving people in change, and leadership effectiveness. We looked at 10 questions that would form an index called Shape the Future. Shape the Future is one of the leadership behaviors at Banner Health, so it really spoke to us in terms of that's something we were promoting, yet it was something we were finding from our employees we weren't doing very well.
And you've been nice enough to offer this 10-question index, so any of the viewers can go and see this. Maybe you could just talk about a few of the things that you focused on. This is, I guess we're in the third year of this journey, aren't we?
We really started the first year creating awareness for leaders. What is Shape the Future? What's it all about? And what's their role? Our leaders tended to see it as something different than what their work was, and we wanted to bring that back home to share with them. We weren't asking them to do something in addition to their job. We really wanted them to lead their employees through talking about changes that were happening in the organization, explaining to employees why those changes were happening, and helping them to participate in changes that impacted their work environment. The second year was really involved in helping people to understand change. So from both a system perspective across the organization, we messaged all of our changes in terms of why change was happening, and we asked every leader to do the same, involving their employees in changes and explaining why things were happening, not just what they were. And in this third year, we're moving on to participation. We're looking for our leaders to involve their employees in changes that impact their work environment.
Ed, let me turn to you now. The Banner Health has 36,000 employees. Employee engagement is obviously very important. Talk about it from your perspective in the C-suite, this engagement initiative. How important is it?
It's really important, Ryan. When you think about employee engagement, it has to be connected to business outcomes. And so that's what we tried to do at Banner Health, connect it. And we were able to do that at the strategic initiative level on our scorecard at Banner by talking to the board about how it's not just engagement. It's more than that. It is about the business outcomes. We looked at business outcomes from the patient experience scores to actually operating margin, and looked at leadership effectiveness as well. We were able to measure all of those with the items on our engagement survey, but we separated them out and then looked at the top performing facilities within our organization as compared to the bottom performing. That started to share with us a gap, a very consistent gap that we saw, and one that we needed to close on all of those factors.
Now you can actually see a difference in your engagement scores and the operating income for certain groups of employees, am I right?
We looked across our acute care facilities, and what we found is the facilities that performed better on these 10 questions absolutely outperformed their counterparts on operating margin, employee engagement, and patient experience by about 30 percentile with patient experience, which is a huge focus for us. So I think it's not to be dismissed that we just focus on these 10 questions. We do know they absolutely correlate to engagement as well as drive business outcomes.
So Beth, if somebody's watching this and considering doing their own engagement, maybe they're going to even look at some of the resources you're going to provide here. What is a lesson or two that you would offer after 3 years of doing this?
I think it's to customize it to you. I don't think we're proposing that these 10 questions and our approach would work for everyone, but I think as I look back on our story, everything we've done and the decisions that we've made have been based on data. From the fact of we looked at all of the questions on our 2010 survey and identified the pain points for us, where we had opportunities to improve, all the way to what question do we focus our leaders on this year. We're always looking at the data, looking for what our employees are telling us, and then customizing our approach and our solution based on what we're hearing.
And Ed, what's been the key to get the C-suite engaged in this engagement process and get them bought into this?
It's the data, Ryan. And as we go forward, we're looking at the behaviors as well. So people are seeing the change in the behaviors and how we interact with each other at Banner over the last 3 years. When you look at Banner and you look at having the right Banner person versus like the best in the industry, we really are looking more for the best Banner person. And we're able to define that even better through the behaviors and using that in our behavioral interviewing process. So we start to bring on the right kinds of executives. And what's happening too is we're finding that these behaviors are changing in terms of what a successful executive looks like. So now, most recently, about 6 months ago, we took another look at it and said, you know what, these success behaviors are very different. Collaboration and humility started to pop up, started to rise up to the top. Those are the ways in which we really can get work done at Banner and be more efficient.
Just mechanically, Beth, how often are you doing the survey?
Yeah.
And what kind of response do you get? And how do you ensure that you get high response?
We survey every year, so right now we're in the August timeframe. We have had an 86% participation rate from our employees and about a 60% from our physicians. It's the hard work of all of our folks out in the field, asking people to take the survey, talking about the importance that it is for our organization, and using actual examples and the results that we've gotten because feedback was taken seriously and put into place.
One of the things that we talked about before the cameras started rolling here was the baseline scores you got for trust of your management and your leadership were very high. And we were talking about that, it was sort of took you aback. I don't know if you had you saw that as an opportunity and what you did with that opportunity.
We absolutely saw it as an opportunity. We realized as we looked at it that we had tried to do that. In our organization, our CEO will talk about how visibility breeds credibility, credibility breeds trust. If you want to be trusted at Banner, you need to be visible. I think that applies to any organization. So we have some trusted leaders, and what we found too was that gap that Beth talked about and identified between how leaders understood where we were going and were involved in it and how employees didn't. We can close that using the trust of the leaders with the employees, getting them to communicate the kinds of goals that we set for them. Focus on that, creating that understanding, having that dialogue with them.
You had some trust scores that were absolutely, I'm sure, would be the envy of many other companies, didn't you?
We did. That might have been an unfair advantage at the beginning.
We talked for a minute about how you've taken a change in view from talent management to a talent optimization. Maybe you could talk about the evolution of Banner Health about that.
When I first arrived at Banner Health, we were doing what I would call talent management. It wasn't even integrated, though, at that point in time. It's very separate. What we're trying to do with the idea of talent optimization is to understand what are all the gifts, what are all the benefits that can come from an employee being engaged with us. What is special about what they bring? And so talent optimization really looks at making sure that we have the right person in the right place at the right time with the right skills, with the right motivation, and in the right numbers. So it's a big challenge to be able to do that. Some folks call that talent management. I call that talent optimization. That's where we want to go. So the people who show up every single day are so engaged that we're getting everything from them that they have to offer, and that engages them, that their skills are being recognized, their skills are being utilized, rather than wasting.
Now, Beth, this is a multi-year journey that we're on here. Obviously, the last few years, the economy has been tough, to say the least. I just want to make sure that I understand. You've seen scores increasing every year in this brutal economy, or have there been some things that you thought that have become challenges that you weren't expecting?
Our first year was challenging. We didn't hit our target in terms of percent favorable, but what was interesting was the database we were comparing against actually went down at a time where we held steady. So I think across the journey we have seen different blips in our journey, but for the most part we've stayed strong and we've continued to move forward. This past year we exceeded our stretch target, which was a phenomenal feat for us during times of tremendous change, and we really worked hard to make sure our employees always understood what was happening in the organization, why, and gave them opportunities to be involved throughout the journey.
Beth, the index scores that you showed me beforehand here said that you had a stretch goal, but in reality, Banner actually exceeded that stretch goal. Maybe you could just talk a little bit more about that. Shape
the Future is one of our strategic initiatives at Banner, as Ed mentioned earlier. And so each year we set a base target as well as a stretch target. Our base for this year was 66.7%, which means that percentage of our population said they strongly agreed with the 10 questions that we were asking them. And then our stretch target was 67.2%. We exceeded both by 68.3%, which blew us all out of the water in terms of actually what we were able to accomplish. But I think it speaks to the focus that we had all of our leaders engaged around in making sure people understood why change was happening and some of the different interventions we put in place to help make them successful.
Ed, in terms of managing this initiative, Shape the Future at Banner Health, talk about some of the considerations that you've put into that.
Well, I think what you've got to do is make sure that you have a way to engage people. We talk about engagement as a word. Putting it into practice has something to do with the work that people do each and every day when they show up. One of the organizational competencies that we've been focused on in the last 3 years is project management. and finding a way to involve more and more people in the work that we're doing, and to also give people who are individual contributors an opportunity to lead. They're leading a team. They're focused on a result. It's time bound. So they can see the achievement of their works in a very short time.
Ed, can you just talk for a second about the bottom line impact of this project?
When we look at how it affects the economics of running a business, it's still true that when your engagement scores go up, and in our case, when they go up 1%, your return on investment goes up. And for us, the operating margin goes up 0.5% for every 1% growth we have in our engagement scores.
Fantastic case study. Banner Health, of course, 36,000 employees, 7 states. I want to thank Beth Stiner and Ed Oxford from Banner Health. And for WorkSpan TV, I'm Ryan Johnson.